Hello and welcome to this, the third episode of Medigold Matters. Medigold Health is one of the UK's leading providers of health and wellness solutions to anyone who employs people, making sure that those people are fit, healthy, able to work, and well. I'm John Griff, and month by month we hear from a variety of people contributing to the Medigold story. This month we profile someone quite new to the company, but who brings an absolute wealth of relevant clinical experience to it. Dr. Kentigern Haworth now leads a team of clinicians for Medigold Health in the southeast of the UK. We met to talk about his own medical background, to discuss how occupational health needs to be positioned at the core of employment considerations, and not simply as an add-on to the package. We also discussed how occupational health could play an increasingly significant role in protecting the NHS itself on the front line.
We are looking at a manpower crisis. We are looking at real challenges for primary care. Recent figures suggest that in the next few years, at least one senior full-time GP in every single practice across the land will be retiring. And these are people at the top of their game. These are the senior GPs. So a huge challenge to replace that. England, occupational health is available to GPs only. So what about the receptionists? What about the nurse practitioners? What about the physiotherapists? Who is providing that? There is a huge inequity there.
That's Dr. Kent Haworth, and this is Medigold Matters. Kent's interest in medical matters began during his own education. As a student at St Andrews, he joined the Royal Army Medical Corps as a cadet before signing on to a military career which saw him deployed with Her Majesty's forces at battalion level. On leaving the forces, he became a GP and prior to joining Medigold Health, spent a number of years bringing medicine and education together in the city of Jeddah in Saudi Arabia. Now he still deals with his clients and patients face to face. As he told me, it's something he continues to relish.
Absolutely. And I think for me, there is nothing better than having a good relationship with your patient, seeing things move in the right direction. Occupational health is nothing unless it helps to move things along. And sometimes we can intervene or make suggestions that really make a huge difference, and whether that's face to face, whether it's video, whether it's remotely down the telephone, the sense of achievement through delivery of our of what we've been trained to do is very satisfying.
Kent, there's a dividend that has come in recent years, shall we say, from the work of the medical corps, the work of medical people within the military deployed into places like Afghanistan, and a lot of those techniques have now started to find their way into civilian life. How do you feel that the military has influenced new thinking and new practice, not only in terms of physical medicine, but also mental medicine as well? We're far more aware of post-traumatic stress disorder. We're far more prepared to talk about it in this day and age. We've only recently had World Mental Health Day. How do you feel that all of that has played into the hands of occupational health and the dividend that then comes from it?
Absolutely. Military medicine in war and peace has made a huge contribution to advancement in medical science. In time immemorial. We're talking, before the Christian era and Hippocrates, all the way up to more recent times. Stemming from the development or the refinement of triage during the Napoleonic Wars. Public health has been a huge leap forward since the days of Florence Nightingale and Mary Seacole in the Crimea. Tropical medicine, leishmaniasis, William Leishman discovered that and discovered the link with sandflies while he was working with the British Army in India. Nutrition, I spent some time in the Navy, and nobody who's ever been in the Navy Medical Services will not have heard of a chap called James Lind, who was a pioneer of naval hygiene and discovered the link between scurvy and citrus fruits, or the lack of causing scurvy. Communicable diseases, very topical now. Vaccinations. Typhoid was developed over 100. Typhoid vaccine was developed over 100 years ago, and in an interesting parallel with today and vaccine uptake. I was reading recently that back in the early 1900s, the typhoid vaccine was made available, but it wasn't made compulsory. Yet, through a public health campaign in the army, they got up to about 90% vaccination coverage, and for the first time in the First World War, disease was not the primary cause of death, and I think that's a huge contribution that the military medicine has made to contemporary medicine. But you mention, or you alluded to some of the primary issues that we face in occupational health today, which is rehabilitation following physical injury, but also rehabilitation following mental health injury. And again, looking at the lessons learned from horrendous injuries in all wars, but particularly in the First and Second World Wars, the development of a really joined up approach to rehabilitation and prosthetics was driven by through necessity, but also mental health and post-Vietnam era post-traumatic stress disorder, which became more recognised then, even though battle shock was known in the earlier part of the century. That has really led to a much greater understanding of both diagnosing and treating post-traumatic stress disorder, which for the frontline services, whether that's fire, police, military, is something that is prevalent and really responds well to the right type of treatment.
It's fascinating to hear you talk about what, to me as a layman and as a civilian, sounds like small steps from the military's perspective, like diet, like vitamins, like what we learn from day-to-day life. We are sitting right now at a time when, in medical terms, occupational health, medical care, both are about as high profile as they have ever been. And I don't mean just in terms of a word that none of us really used 2 years ago, namely pandemic and COVID-19, a word that was far more frequently used, but was equally, in its fullest sense, a real killer. Flu has been on a lot of lips recently, in a way that it wasn't last year. There was very little in the way of flu last year, thanks to coronavirus and COVID-19. What's your view about flu and the vaccination program that goes with it? Because we constantly hear there is a vaccination available for it, you should have it. And yet we also hear people who turn their backs on taking something that is available to them that could genuinely save their lives.
Absolutely. So I first of all, I'll say I have booked my flu vaccine. I will need to check my diary, but I think it's sometime later this month. And because I'm the ripe old age of 54, I get it free. So I will be returning my free vaccine voucher to
Age
HR.
has its benefits.
Age has its benefits. You might expect me to respond by saying I cannot see why anybody would not have the vaccine. There are some people who shouldn't have the vaccine, those who have severe allergic reactions to previous vaccinations. But I understand also that even if you also people with vaccines with allergies to eggs, there are low egg or egg-free vaccine variants that are available. So speak to your pharmacist if you're uncertain. But vaccinations, specifically looking at flu vaccinations, are there to prevent you from becoming sick in the first place. The flu vaccines will prevent you, if you do get flu, even having had the vaccine, it will prevent you from becoming seriously ill, prevents hospitalizations, and it also helps as a preventive tool people with chronic health conditions. Prevents deaths in children, and also illness, severe illness before, during, and after pregnancy. And most importantly, I think, collectively, it helps people around you. And for those people who can't take the vaccination, I think there is a responsibility on those who can take the vaccine to do everything that they can to prevent them, from becoming unwell. And I think there's lots of parallels there between the flu vaccine and the COVID vaccine, and any vaccine that is highly transmissible in the community.
Kent, you're talking about prevention being better than cure there, and there's an implication for protecting the NHS, because if we get those vaccinations, we're not going to end up in front of our GPs, and we'll talk about the lot of GPs. There's also a reference in there that you made to talk to your pharmacist rather than talk to your GP. And we can pick up on that as well a little bit later on. But that note about prevention being better than cure, we're going in towards the latter part of autumn. Winter will be around fairly soon. We're on short days and long nights. When it comes to occupational health, if prevention is better than cure, and clearly it is, what should business owners do to ensure that their employees remain healthy and therefore effective at work?
That's a really insightful question, and I think the answer comes from comes from studies and up to date evidence from the academic centres around the world, particularly Finland, who are leading the way in universal access or highly dispersed access to occupational health. My answer to your question is that I would recommend that all business leaders push occupational health to the top of their agenda. Make it a board level topic, a recurring feature, a recurring agenda item, because investing in occupational health and regarding it as an investment rather than a cost is going to bring huge benefits. It has been and makes a huge amount of business sense. I don't think there's any dispute about that. It has been said that annually we lose about approximately £100 billion per year to illness, and that's equivalent to the annual budget for the NHS. So we are running two NHSs here in terms of the cost. We've got the real NHS and a doppelganger NHS, and it absolutely makes sense that all businesses invest in occupational health services. Some will be able to afford a broad offer, and others will be able to will not be able to afford exactly what other people, the more wealthy companies are able to provide. But anything in terms of accessing occupational health, I think is something that that organisations can invest in, particularly from rehabilitation and a mental health perspective.
You talk about investment versus cost. If I can ask you to put a slightly more business orientated hat on rather than a clinician's hat, or greens or blues or whatever colour they are. If we talk about the package, every employee thinks about the package in terms of more than just the pay packet. So the package now includes a whole series of other things. And I've spoken to people in the past when it comes to the recruitment and then holding on to the staff who are the most important asset of any business. The package, well-being as part of that package, physical and mental well-being as well. They've perhaps never been quite as fundamental to a person's employment as they are now in terms of retention, but also attracting people to businesses. Should that be available, and is it sufficiently well available to all levels within any business, large, small, medium, whatever it might be? Because clearly there is a cost implication to that. Has business woken up to the investment and then to the dividend of providing occupational health for staff?
Well, we in occupational health have been brought up on the notion that in the UK currently about 50% of businesses have access to occupational health services, professional occupational health services, 50% don't. That figure has recently been revised downwards, and it is likely that it is south of 30% of businesses have access to what we would describe as high quality professional occupational health services. So on the one hand, businesses recognise the investment opportunity here, investing in your people, investing in occupational health, to drive down sickness absence, to promote wellness, but on the other hand, we see that very few, in terms of the total businesses in the UK have access to it. So there's some disconnect there. The government's response to health is everyone's business is seeking to address that, and there is very good reason to be hopeful that things are going to be moving in the right direction. The Society of Occupational Medicine, you might imagine, is very supportive of universal access to occupational health. There are some commentators will say that back in 1948, occupational health should have been made part of the NHS offer, but it wasn't. That said, we are where we are, and looking abroad in the Nordic countries, particularly Finland, we can see how they have a really swept up, coordinated, funded occupational health offer for all their for all employees, and that's something that figures suggest that it can effective, joined up, coordinated, multidisciplinary occupational healthcare can reduce sickness absence by up to a half, and the benefits of that to business should be very, very clear.
So the costs of getting into occupational health, whatever the size of your business, and here I cast the question for those who perhaps run smaller businesses rather than larger businesses, for whom therefore that financial investment might be a sizable one. It might be a sizable part of their profit margin, for instance. Nevertheless, you would advocate put that spend into occupational health. It will pay its own dividends in the longer term.
100%, and we need to look to government to come up with policies and support for those companies, those enterprises who hitherto would not have looked towards occupational health for support, not necessarily because they don't want to, but because they don't understand the potential benefits, or simply cannot afford it. But I would say, turn that on its head, I would say that boards, business owners must consider the alternative. Can they afford not to have occupational health? As we all know, worklessness which can result through not having access to joined up occupational health. Worklessness is the single most important factor in health inequality, social deprivation, mortality, and I would put it to all business owners in the UK, whether or not, with that backdrop, whether or not it is whether or not they can afford not to have access to occupational health.
Kent, I want to take you back to your GP days, if I may. When you consider what used to come through the door, arguably what still comes through the door to this day and age, we live in times now where health is very much uppermost in people's thoughts, be it in terms of coronavirus, be it in terms of the flu, be it in terms of just general well-being. What is your take on the health of the nation? And by extension from that, what is the health of the workforce of this country now from what you've seen in the past? Are we a nation of the worried well, or genuinely do we have health issues?
Well, I was recently watched a really, really interesting webinar series hosted by the Society of Occupational Medicine. And Professor Maggie Ray, who's the current president of the Royal College of Public Health, suggested that the UK was becoming one of the most unhealthy nations in Europe, and that health outcomes and employment were inextricably linked. I can't give you any more up-to-date data to back up that assertion, but it rings true. And I think from COVID, the start of the COVID pandemic, there has been certainly an epidemic, tragically, of mental health concerns, and there also has been, through dint of lack of access to screening services, lack of access to what we would, under normal circumstances, take for granted, that we would have access to secondary care, we would have access to all the healthcare provision that we would normally have expected. We are seeing a pent-up demand for medical services born out of ill health because of the impact of the pandemic.
That must mean, therefore, that occupational health in the workplace, must be a tremendous way to head off issues that might otherwise expand into society when it comes to health. It's a great way to, well, for want of a better phrase, nip the issue in the bud by catching it at the earliest possible opportunity. And to do it from an employer's perspective, that ties in the employee to the business. The employer genuinely has more than a simply holistic view of someone's well-being, because actually, if you can keep them healthy, they carry on working and they're more productive.
Absolutely. The whole narrative now is moving, or has been, focused on prevention rather than cure. From an occupational health perspective, keeping people at work rather than fixing them is where we need to be headed. This is where the universal access to occupational health, supported by certainly the occupational health and gathering momentum, gaining traction within government, is where we need to be going. I don't think there is any suggestion that we can't move in that direction. We must move in that direction. The workforce is getting older. The multi-morbidity, or the number of illnesses that people over 50 have, is quite striking if you look at recent statistics. And we need an integrated system. We need to break down these silos in healthcare. There is no point an employee who works has a strenuous physical role, who breaks his or her leg getting it fixed to world-class standards, and then not having access to rehabilitation. Rehabilitation should be, in my view, and this is shared with others, should be part of the offer, should be an integral part of the NHS offer. And occupational health traditionally can provide that kind of support.
We've been accustomed to senior politicians, health secretaries, prime ministers, advisors to the government saying that the prime need is to protect the NHS, one of the jewels of our modern day society. And clearly they are talking about the pandemic, but they could be talking about flu, they could be talking about occupational health and so on. GPs, for the general public, generally speaking, I think it's fair to say, are the embodiment of the NHS, and yet they are the first line, they are the frontline troops, if you like, when it comes to medical practitioning. They are now being criticised. One of the biggest criticisms of GPs and the medical community right now is the ability of patients to be able to see them. It's very easy to say, go and talk to your GP. There's been a lot in the press recently about access to GPs or a lack of access to GPs. Our psyche tells us that we should be able to go through the door and see a GP straight away. There you are as a GP practitioner in your own right. How do you feel about the way GPs are now being perhaps criticised by a government which seems to point the finger, says it's putting £250 million in to support GPs, but telling GPs effectively to get their houses in order and make themselves more available to the general public? What is your view as it applies to occupational health and as a GP in your own right?
So I'm not. I left general practice in 2005 to retrain in occupational medicine. But I loved my time in general practice, and I have always been a great supporter of general practice. As you say, they are the frontline troop. They are in the trenches. They're the paratroopers of primary healthcare within. In the UK. That's not to say that everybody within healthcare has not been affected to some degree or another, and the huge contribution from all parts of the NHS has kept this nation moving forward in terms of the provision of healthcare in the best way that they possibly can. You, I think, are referring to the recent offer of £250 million to improve access, not just improving access, but other things for in primary care, and that comes as a carrot, but there is also a stick. And again, not wanting to make too much of a political commentary on this, there are those who support it, and there are equally many who don't support it, particularly the British Medical Association. And I can see both sides of the story, but what I do see is that we had to change, or general practice had to change its model at the start of the pandemic. It was encouraged to change its model at the start of the pandemic, and now it is being asked to do almost completely the opposite. The polls suggest that the majority of people, 80% plus people, are happy with the current offer from general practice, indicating that the new model has been accepted to a large degree, but 2/3 of people are still would prefer. Doesn't say insist, but would prefer to have face-to-face appointments. But what we are looking at here is a real crisis in primary care, and this is driven by manpower constraints. £250 million for locums, for podiatrists, for physiotherapists is not unwelcome, but it's the value, the converted value into more face-to-face appointments is going to be limited by the availability of professionals to deliver that service. And if they're not there, it's going to be very difficult to provide what the government want us to, what they want GPs to provide.
Well, exactly. I've spoken to my own GP about circumstances like this, and he's saying that the industry, the business, the sector is losing GPs. That's one thing. Retirement is one thing. Recruitment of new GPs, the creation of new GPs through further education, if that isn't going at speed, then there's going to be a shortage of GPs, which means that the existing pressure that GPs are under is only going to increase. I mean, should there be occupational health for the medical community? Are their needs being properly met?
I think that is such a there's such a need for that.
Physician, heal thyself.
Physician, heal thyself. We are looking at a manpower crisis. We are looking at real challenges for primary care. Recent figures suggest that in the next few years, at least one senior full-time GP in every single practice across the land will be retiring. And these are people at the top of their game. These are the senior GPs. So a huge challenge to replace that. And it would be, I don't think this is lost on the government, but what we need to see is real movements in that direction. But you asked about occupational health offer for the our frontline troops in primary care. 2016 saw some moves towards improving occupational health access to those in primary care. Scotland have pretty much got that sorted. Wales have plans to make occupational health available to everybody in primary care. England, occupational health is available to GPs only. Secondary care has access to occupational health, but in primary care, GPs only. So what about the receptionists? What about the nurse practitioners? What about the physiotherapists? What about the who is providing that? There is a huge inequity there. And when we look at how much we lean upon primary care and occupational health to support our patients, whether it's in signposting for mental health, whether it's in accessing rehabilitation or physiotherapy, we rely upon the GPs more than we realise, and we should be supporting them more than we are. The whole general practice team I'm referring to.
So if GPs are the frontline troops for the NHS, and if the Prime Minister is encouraging us as members of the public to protect the NHS wherever possible, Ken, what you're actually saying at the same time is that business owners have their role to play in that through occupational health, and that occupational health itself can be a protector of the NHS going forward, and therefore the costs that go with it, which candidly we all contribute to keep the NHS where it is.
Yeah, and this goes back to the package. Can we lift some of the burden from general practice? They're part of the 250 million offer was that health professionals other than GPs would be looking at the FitNote responsibilities, DVLA checks, possibly looking at increasing the number of allied health professionals who can deliver some of the traditional primary care, general practice, doctor-led functions. So that's all really good news. But should companies be looking at creating a truly holistic occupational health offer, a platform for promoting and preserving the health of their employees by improving access, making more accessible, rapid access to the the crocodiles closest to the canoe, which are mental health and rehabilitation. Some companies do. I worked for a little while for a bank in London after leaving the army and moving out to Saudi Arabia. The package was incredible. Not everybody can afford that, but I saw at firsthand how coordinated, cooperative, well-resourced provision of what workers need can really pay dividends. And we should be moving towards that kind of offer in the NHS. We should be able to offer something for our people that doesn't involve months and months of waiting.
From the horse's mouth, and hugely enlightening. Kent, it's been a real pleasure to talk to you. Thank you.
Thank you.
That's Dr. Kent Haworth, Medigold Health's lead clinician for the southeast of the UK, and my thanks to him for taking the time to talk to me. That's all for this episode of Medigold Matters. Thanks for taking the time to listen, and I hope you enjoyed what you heard. There are other episodes which you can listen to as well at your leisure, and more to come in the near future. Do join me again in a few weeks' time, but until then, goodbye.